Today, we're talking about Therapeutic-M Tablet Multivitamins. These tablets are used to treat or prevent vitamin deficiency caused by poor diet, certain illnesses, or during pregnancy. Vitamins and iron are essential for maintaining good health and are important building blocks for the body. It's important to take these tablets as directed by your healthcare professional. The recommended daily dosage may vary depending on your individual needs. It's best to take these tablets with a meal to help with absorption. Remember to always follow the instructions on the label and consult with your healthcare provider if you have any concerns. When taking Therapeutic-M Tablet Multivitamins, it's best to take it by mouth, usually once daily as directed by your doctor. It's important to follow all the directions on the product package and not to take more than the recommended dosage. For the best results, take this medication on an empty stomach, about 1 hour before or 2 hours after meals, with a full glass of water unless directed otherwise by your doctor. If you experience stomach upset, you can take this medication with food. It's important to avoid taking antacids, dairy products, tea, or coffee within 2 hours before or after this medication, as it may decrease its effectiveness. After taking the tablets or capsules, do not lie down for at least 10 minutes. If you are taking the delayed-release form or extended-release capsules, swallow them whole. Do not crush or chew them, as this may release all of the drug at once, increasing the risk of side effects and decreasing absorption. Additionally, do not split extended-release tablets unless they have a score line and your doctor or pharmacist tells you to do so. Remember to take this medication regularly at the same time each day in order to get the most benefit from it. Some common side effects of Therapeutic-M Tablet Multivitamins include constipation, diarrhea, or upset stomach, which are usually temporary and may go away as your body gets used to the medication. If these effects persist or worsen, it's best to seek advice from your doctor or pharmacist. You may notice that the iron in this medication could cause your stools to turn black, but this is not harmful. If your doctor has prescribed this medication, it means they have determined that the benefits outweigh the potential side effects. Most people who use this medication do not experience serious side effects. While it is rare, a serious allergic reaction to this medication is possible. Seek immediate medical help if you experience symptoms such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. It's important to note that this is not a complete list of possible side effects. If you notice any other effects not mentioned, it's best to consult your doctor or pharmacist. If you're in the US, you can call your doctor for medical advice or report side effects to the FDA. In Canada, you can call your doctor for medical advice or report side effects to Health Canada. It's important to keep Therapeutic-M Tablet Multivitamins out of reach of children, as accidental overdose of iron-containing products is a leading cause of fatal poisoning in children younger than 6 years. If an overdose does occur, it's important to seek medical help right away or call a poison control center. It's suggested to take 1 tablet daily or as directed by a healthcare professional. It's best to take this medication with a meal to help with absorption. Before taking Therapeutic-M Tablet Multivitamins, it's important to talk to your doctor or pharmacist if you have any allergies to its ingredients. This product may contain inactive ingredients that can cause allergic reactions, so it's important to discuss this with your pharmacist. It's also important to tell your doctor or pharmacist about your medical history, especially if you have iron overload disorder, alcohol use or abuse, liver problems, or stomach/intestinal problems. If your multivitamin contains folic acid, be sure to let your doctor or pharmacist know if you have a vitamin B12 deficiency before taking it. Folic acid may affect certain lab tests for vitamin B12 deficiency without treating this anemia, which may lead to serious nerve problems. Before having surgery, make sure to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant or breastfeeding, consult your doctor before using this medication. Remember, it's important to be aware of any potential drug interactions with Therapeutic-M Tablet Multivitamins. This could affect how your medications work and increase your risk for serious side effects. Be sure to keep a list of all the products you use and share it with your doctor and pharmacist. And don't forget to consult with them before starting, stopping, or changing the dosage of any medicines. Therapeutic-M Tablet Multivitamins can decrease the absorption of other drugs such as bisphosphonates, levodopa, penicillamine, quinolone antibiotics, thyroid medications, and tetracycline antibiotics. It's recommended to separate your doses of these medications as far as possible from your doses of this product. Your doctor or pharmacist can help you find a dosing schedule that will work with all your medications. If your multivitamin contains folic acid, be sure to inform your doctor or pharmacist if you take certain anti-seizure drugs. It's also important to note that this medication may interfere with certain lab tests, potentially causing false results. Make sure to inform lab personnel and all your doctors that you use this drug. If someone has taken too much of Therapeutic-M Tablet Multivitamins and is experiencing severe symptoms such as fainting or difficulty breathing, it is important to seek immediate medical help by calling 911. Alternatively, contact a poison control center for assistance. In the US, residents can call 1-800-222-1222, and in Canada, residents can call their provincial poison control center. Symptoms of an overdose may include stomach pain, nausea, vomiting, and diarrhea. It is important to be mindful of the recommended dosage and to seek help if an overdose is suspected. If your doctor has recommended Therapeutic-M Tablet Multivitamins, it's important not to share it with others. Make sure to attend all your medical and lab appointments. Some brands may also include ingredients like docusate. If you have any questions about the ingredients in your specific brand, be sure to ask your doctor or pharmacist. It's important to remember that this product is not a replacement for a healthy diet. It's best to get your vitamins and minerals from nutritious foods. Be sure to maintain a well-balanced diet and follow any dietary guidelines given to you by your doctor. If you forget to take a dose of Therapeutic-M Tablet Multivitamins on your prescribed schedule, take it as soon as you remember. If it's close to the time of your next dose, then skip the missed dose and take your next dose at the usual time. Don't take double the dose to make up for the missed one. When it comes to storing Therapeutic-M Tablet Multivitamins, it's important to keep them at room temperature and away from light and moisture. Avoid storing them in the bathroom, and be sure to keep them out of reach of children and pets. When it comes time to dispose of this product, it's important not to flush it down the toilet or pour it into a drain unless specifically instructed to do so. Instead, properly discard the product when it's expired or no longer needed. If you're unsure how to do this, it's best to consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.